Welcome again to our focus on Facebook Live. I'm Dr. Hussein Kermali, Chief Medical Officer here at St. Mary's Hospital in Waterbury, Connecticut. Each month we have been highlighting a specific clinical department and wanted to give you some of the insights to services and providers that we are able to offer here at the hospital in the Waterbury market. We have taken a little bit of a break as some of us went on vacation earlier in March, and the last time we were talking with Dr. Scandrett from cardiology. Today we are going to actually be highlighting a different service from the emergency department. St. Mary's Hospital is the only hospital in the region that actually provides pediatric emergency care by pediatric trained emergency medicine physicians. And today I am joined by Dr. Karl Hellstrand. He is our physician leader and administrator for pediatric care in the emergency department. This is huge because, as we're going to find out, kids are not adults. It's not just a miniature size of an adult's body or therapies, and they do require special attention. So, Dr. Karl Hellstrand, I appreciate you coming in and thank you for joining us.
Thanks for having me.
So, tell us, how is treating a pediatric patient different than treating an adult?
It was a great transition, or introduction rather, to pediatrics and pediatric emergency medicine, and it's kind of our mantra that kids are not little adults. We see in the emergency department patients all the way from birth, sometimes birth in the emergency department, all the way through adolescence.
Sure.
And each stage in their lives during that time has very unique features that we need to think about. And it takes that little bit of special training and expertise to be able to take care of those patients the right way.
So do we have different protocols that have been established amongst our physicians? Are there special standards of care that we focus in on? Tell us a little bit.
We always try to use evidence-based medicine like all other parts of medicine.
Sure.
And thankfully in the pediatric emergency medicine community, we have amazing research facilities and major academic centers that really help us to adhere to a standard of care for various medical conditions and procedures within pediatric emergency medicine. We have the luxury of having two wonderful pediatric hospitals in the state, Connecticut Childrens and Yale, and we work very closely and have a great partnership with Connecticut Childrens, and they have a robust policy, procedure, program in place that we use with our education with Connecticut Children's. So we have all kinds of different information that we use within our group to make sure that we have a standard of care for pediatric patients in the emergency department.
Great. So, when we talk about a pediatric trained emergency physician, what is that training, that specialized training that you've gone through and some of our other ED physicians and doctors have gone through?
So after medical school, standard medical school, we go through a pediatric residency, and that's 3 years.
Okay.
And then with that, we get board certified in general pediatrics, which is, I would say, a very strong base and what we use very often in the pediatric emergency department. And then to become specialized in pediatric emergency medicine, we do an additional 3 years of training in fellowship and become board certified in pediatric emergency medicine.
So this is even like much more advanced than even just emergency medicine training.
I'm not sure they would like it to be said that way.
We'll talk about that with them.
But as far as years go, I mean, because general pediatrics is, it focuses on pediatric care, but not necessarily emergency care.
Right.
So general pediatrics.
Sure.
So we have to add on that entire level of emergency care,
Yeah.
specifically pediatric emergency care.
Sure.
So it's a lengthy process, but a rewarding one, and a very beneficial one to the community.
So when I think about the training that I've been through, an adult, you have like a grand span of 18 all the way to 99.
Yeah.
And many times, even in our medical school or even in training as fellowships and residencies, you sometimes have these simulations or sort of practice sessions where you actually go in and you have live adults. But what's the simulation like with children? I can't imagine it's the same, or is it?
Well, in training, it's always a part of our education as we go through, and to get the our board certification in fellowship for pediatric emergency medicine, it's part of the training. But medicine is lifelong learning,
right.
So we always try to keep that going in various ways, and we're lucky enough that we have learners of all different levels here. We have medical students that do their pediatrics rotations from Quinnipiac University. We are very lucky that we have our peds emergency medicine fellows from Yale and Connecticut Childrens that rotate through their kind of community service here.
Beautiful.
And we also have several institutions that send their advanced practitioners here for their pediatric experience.
Great.
And that kind of allows us to have more kind of drive to continue our education. And part of sometimes what we do is simulation. With Trinity Health of New England, we have our travel simulation team out of St. Francis that we work pretty closely with to come and provide us with support to do those simulations, whether it's in situ in the emergency department to run cases, or procedural workshops for us peds emergency medicine physicians, but also the emergency physicians and our APPs. And thankfully in pediatrics and pediatric emergency medicine, we see very sick kids, we see trauma cases.
Yeah.
But thankfully, compared to the adult population, we see them less frequently, which is a good thing.
Which is a good thing.
But it makes it more important for us to be comfortable and prepared when those cases do happen. So that's where simulation and those workshops are very important, because they're very high risk and low frequency.
Yeah.
So when those cases come into the emergency department, we need to be ready, and we need to be confident that we can treat those patients the way that they need to be treated and not panic.
Yeah, and the first time's the only time that we have the opportunity when it's a real person that's coming through.
Right. Yeah.
Particularly, and this is so important, particularly as we get into the spring and the summer months, with now a lot of those restrictions that we may have had last summer really able to be controlled now. And so the communities have done a great job, and the kids now are running free, so to speak, which kids will bump their heads every once in a while. I know I did. But to have somebody who's ready and trained if something even more significant were to happen right away is I'm sure a great source of comfort. And which brings us to the next topic. What does that mean for a patient or a parent, in fact, when their child arrives to St. Mary's Hospital? What can they expect when they come through the door with their child who's sick or injured?
Right. So I think it's very important, and when parents bring their child to the emergency department, they expect the best care possible, of course. And our emergency department in general is a wonderful place, fantastic providers all around.
Right.
But for kids, like we're talking about, it's specialized care. So for them to be able to bring their child to the emergency department to see a pediatrician, a pediatric emergency medicine physician, it means a lot. And again, we see from birth through adolescence. So the care of a 2-month-old with fever is a lot different than a school-age child with fever.
Right.
And knowing those nuances, we talk about trauma, not small adults, so their body size can lend to different injuries than you might think about with an older person.
Sure.
So that's very specialized. most medications in pediatrics are weight-based, so and they're different medications in adults. So knowing what those doses are, knowing what the medications are, the risks, the benefits for each situation, are very important. And having that ability to talk with parents about those things is very important. So parents bringing their children to the emergency department most of the time, not 24-hour coverage yet, which we'll talk about, but most of the time we have the ability to for them to be seen by a pediatrician.
Right.
Yeah.
And one of the things that I love about St. Mary's is our relationships that we've built within the community, not only with providers, but also just with community agencies and agencies around the state. One of those is our relationship with Connecticut Childrens Hospital, and that partnership. And how does that help you when you're managing a patient in the emergency room?
It's incredibly helpful. We're lucky and fortunate here to actually have a medical inpatient floor run by Connecticut Children's in our hospital. So it's important for families, if possible, with the situation, to keep them in the community, to not have to transfer out. Always a resource. Connecticut Children's is always a resource for us to be able to call to ask questions about management, care, the possibility of transferring versus keeping here in Waterbury.
Right.
Like I said, we partner with them as far as all of our protocols that we use for treatment of children. We work closely with the advanced practitioners, the attendings that are the hospitalists, also in Hartford at the main hospital.
Gotcha.
So the relationship is very valuable.
So you had mentioned we've got a floor here dedicated for Children's Hospital. It is essentially CCMC at St. Mary's. Yeah. And so quick admissions are able to go there. What about the more complicated cases? What's that relationship like?
Yeah, so sometimes it's very clear trauma cases, medically complex children oftentimes need to be transferred. But it's a conversation that we have with the team up in Hartford. And some of those cases, like you mentioned, the quick admissions, those are cases that we can keep here, which is wonderful.
Yeah.
But otherwise, depending on the severity of the situation, Connecticut Children's has their own critical care transport team that can actually be deployed from Hartford to come and pick up a child here and transport them to Hartford.
So, I mean, that's phenomenal, particularly when I think about the communication that's involved there. And I'm a big proponent of clear communication. Because a lot of the times when things happen in medicine, as we've seen, it's because things aren't well communicated. But it sounds like this is a very buttoned down, clarified process.
It is. And one of my focuses, especially working more in a community setting, is preparedness for pediatric care in the community.
Right.
We know that most kids across the country aren't seen at primary pediatric hospitals. They're seen in community settings.
Right.
And a huge part of that is making sure that the community hospital is prepared to see the children that come in. And that spans several things, but part of it is transfer care. So making sure that children are stabilized and that there's good communication with the transferring facility, Connecticut Children's in Hartford, and making sure that is established as basic as discussion with the family, so they understand what the plan is and where they're going to be heading. Separate from the medical care. So all of that we try to do as efficiently and consistently as possible.
Yeah, I can't imagine what a family goes through when they're dealing with something like that. But to have that reassurance that you're taking care of them here at a pediatric capacity, and that you're handing it off to another very streamlined process, very efficient, but well communicated, so that they're always kept in the loop. I think that's great.
Yeah.
So where is the value? You talked about many community hospitals not having the pediatric care. What is the value? What are some of the typical cases that you see here that really illustrates the value of having that pediatric emergency care available at our emergency room?
Yeah, and I think that ranges. We've touched on it a couple of times. That span of ages that we see. So we have the very littlest patients. Sometimes it is a critical case, a critically ill child, but sometimes it's a new parent that is wondering about formula volumes, or
Sure.
how their child is acting, and having a pediatrician talk to the parents in that case is invaluable, and we're kind of an extension of their primary pediatrician at that point.
Yeah.
And then, it ranges from trauma care, like I mentioned, very specific features in pediatric trauma cases that are different from adult cases. Very important to keep in mind. And within trauma, we have head injuries, we have fracture care. All of those things are very specific to pediatrics. The acutely ill medical patients with asthma, seizure,
Right.
Those are cases we see that, again, are very specific with medications and dosing. And then we also have some of the lesser acuity situations, fevers, upper respiratory infections. All of those even have their very specific treatments that
Sure.
are different from adults. Some over-the-counter treatments that adults use for cough and congestion aren't appropriate for children.
Right.
And they can, in fact, be dangerous.
Sure. Wow.
So I think the examples range from the most highest acuity trauma cases to the lesser acuity situations like viral illnesses that still need that pediatric touch or expertise, so to speak.
Now, something that's sort of a little bit off script, which is fine. I like having the conversation. COVID in children, I think, is a big topic that a lot of parents wonder about. How do we manage, that child who comes in now with a fever? They've been at school, plus or minus on the mask, or been playing soccer. They come in with a fever. What's going through your mind when you see an 8-year-old coming in with fever? What sort of strikes you as keys that maybe parents should clue in on how they're
Sure.
managing their children?
Yeah, and it's it's become a little bit more, I don't want to say complicated, but more things to think about. Especially as things have opened up, and some school districts don't have a mask requirement anymore. Those other causes of fever that we used to think about, they're back,
Right.
and they're here. Flu is back.
Sure.
Just cold viruses are back. But COVID is still around. So depending on the age, it's an opportunity to talk about vaccination status. And then, thinking about what kind of the disease progression has been so far.
Yeah.
Are they well appearing with a fever for one day? Has it been several days? Because we have to remember that, with the trends in COVID, again, we have to think about more concerning features like MIS-C, which MIS-C, which I'm sure most folks have heard about at this point, multisystem inflammatory syndrome in children.
Right.
So all of those are things to think about. We have the ability to do COVID testing
Right.
still in the emergency department. So making sure that the child is stable, talking about the process of their illness so far,
Yeah.
making sure that the parents are comfortable knowing what to watch out for in the next few days
Yeah.
after the illness, and taking each case as it comes.
So, you're an educator as well as a physician, which is fantastic. So let's go over just, one key point for parents in terms of if your child does have a fever, this is a warning sign you want to look out for, and,
Sure.
and maybe things that they can do ahead of time to help them.
So fever is the body's way to react to an illness. And we tend to say that fever by itself isn't necessarily dangerous or immediately harmful, unless we're talking about specific ages,
Right.
Less than 3 months old.
Sure.
But otherwise, if they're generally doing okay, bringing the fever down is important with ibuprofen and Tylenol. We start to get a little bit more worried when we see a fever going on for 5 days or more. The child is especially lethargic, not drinking specifically, or having as much urine output.
Okay.
Those are more concerning features
Yeah.
that deserve for us to be looked at.
And you talk about not being active. I know my little guy, when he's running around,
Yeah.
if he's like sniffly or whatever, I'm thinking he's still running around.
Yeah.
And the moment he stopped running around, that's when we were like, there's something definitely wrong here. And that's exactly what his pediatrician said, is he does not look like what he normally did.
Yeah. Yeah, and we trust, one thing in pediatrics is that when parents come in and tell us that something is different, that means a lot.
Yeah.
That means a lot.
Right.
So we never, take that for granted or dismiss it. If something's not okay for the parents, then that means that it's my turn to figure out that things are okay, or that we need to do more.
Sure.
Yeah.
And that's that conversation, that and part of that communication, which I love. So let's go back to what we are able to offer. You had mentioned we're not at 24 hours yet, but tell us about what the services that we are able to offer downstairs in our emergency room.
Yeah, so as far as pediatric emergency medicine physicians,
right,
like
so
myself,
we're talking about pediatrics.
Yeah, we have.
So our emergency room is open all day long.
We're open 24 hours, yeah. So we have coverage during the week, 19 hours, almost the entire day, from 7 a.m. Until 2 a.m.
Sure.
We have 4, double board certified pediatric emergency medicine attendings, which is new for us, and it's amazing to have that.
Yes.
On the weekends, we have coverage during our busiest hours, traditionally, on Saturdays and Sundays, for 10 hours.
Okay.
We have an amazing group of advanced practitioners that we work very closely with and train. We have the simulations and the procedural workshops with them.
Right.
And they're always around during those off hours to help with the pediatric care.
Yeah.
And then we have our general emergency medicine physicians who also are amazing during the other times of the 24-hour emergency
And we're going to be talking with Dr. Kikowski in a couple of weeks as well. Yeah. But it's important for us to understand you have your team that's there with physicians for those hours that we've talked about, but you've trained the same way that you're training other emergency fellows in pediatrics and other students of medicine. You've trained our APPs, our advanced practitioners, to also provide this pediatric care that at a very similar level. Yeah. So even though your physician team may not be here, their pediatric training for our advanced practitioners is still very robust.
Correct. And they have the resources like we talked about with Connecticut Childrens, one being in-house, that they can talk to the pediatric advanced practitioners upstairs on the floor. Right. And also always have the ability to speak over the phone with attendings in Hartford.
Great.
Yeah.
Wonderful. Anything else you want to add about our pediatric services here that you feel is, hey, we gotta remind our community about this?
Well, I think it's the fact that we're here, and St. Mary's is just an amazing hospital for what we have to offer in the community for pediatrics. And that goes from our nurses to our advanced practitioners, to the attendings, to the emergency physicians, to Connecticut Children's being in the hospital, to our administration that's forever supportive of what we're doing here and what we're providing to the community. So making sure that the community knows that we're here to help with their pediatric family members and everybody they know.
Yeah. You mentioned that collaboration. We look to our teams to really help give us guidance in terms of what we need. And I remember with bringing you guys on board, the first thing you guys said is let's expand this. Let's be able to deliver this type of care the way the community needs. And that's what we've done. And I'm happy to see where we are today and where we're planning to go for the future.
Yeah.
Thank you so much, Dr. Hellstrand.
Yeah.
Really excited. Yeah. Thank you, everybody, also for joining in. Our next Facebook Focus Live, we're actually going to continue with our discussion on emergency medicine. We're going to sort of move up to the adult world, and hopefully we'll be able to bring in one of our physician leaders in adult emergency medicine, Dr. Kikowski, hopefully to be able to join us and have the conversation. Once again, thank you for joining us, and have a safe day.